Reports of widespread disruptions to domestic tourism and travelists across the United States have surfaced following a series of high-profile international public health alerts. These reports indicate a growing public anxiety regarding hantavirus, a family of viruses typically associated with rodent reservoirs, which has recently dominated headlines due to a rare and lethal cluster detected in the South Atlantic. While social media headlines suggest a total cessation of domestic travel, official data from the Centers for Disease Control and Prevention and the World Health Organization suggests the current risk to the general American public remains extremely low. To understand the current climate of concern, one must look at the specific nature of the hantavirus family. Most hantaviruses found in North America, such as the Sin de Nombre virus, are not known to spread from person to person. Instead, they are typically transmitted when humans inhale aerosolized particles of urine, droppings, or saliva from infected rodents, most notably the deer mouse. However, the current international situation involves a much rarer and more complex strain known as the Andes virus. This particular pathogen, primarily endemic to South America, is unique among hantaviruses because it has a documented history of limited person-to-person transmission. The current framing of this story is built upon the May 2, 2026, notification to the World Health Organization regarding a cluster of severe respiratory illnesses aboard the Dutch-flagged cruise ship, the MV Hondius. The vessel, which carried 147 passengers and crew from 23 different nations, reported a series of cases characterized by fever, muscle aches, and rapid progression to severe respiratory distress. As of the second week of May, the cluster has resulted in 8 reported cases, including 6 laboratory-confirmed infections and 3 fatalities, representing a case-fatality ratio of approximately 38%. Geography is a critical factor in this reporting. The ship's itinerary included remote stops such as South Georgia Island, Tristan da Cunha, and St. Helena, making contact tracing a complex international logistical challenge. The fear currently impacting domestic travel appears to stem from the possibility of imported cases and the unique person-to-person capability of the Andes strain, which distinguishes it from the isolated cases occasionally reported in states like New Mexico, Nevada, and California. Public health officials are now tasked with balancing the need for heightened surveillance with the goal of preventing unnecessary panic. Despite the end of tourism claims, agencies have not issued orders to halt domestic movement, but they have increased the frequency of health alert network advisories to ensure clinicians are prepared to identify symptoms in travelers returning from impacted regions. The core of the current public health response is centered on the coordination between the CDC, the State Department, and international partners as they manage the repatriation of American citizens potentially exposed to the Andes virus. On May 8, 2026, the CDC issued a Health Alert Network advisory specifically to inform healthcare providers of the potential for imported cases. While the end of tourism headline suggests a broad domestic crisis, the CDC's verified information maintains that the risk of spread within the United States is considered extremely low. The operational focus has shifted to the logistics of medical evacuation. American passengers from the MV Hondius are being transported via specialized medical repatriation flights to Offutt Air Force Base in Omaha, Nebraska. From there, they are being moved to the National Quarantine Center at the University of Nebraska, a facility specifically designed with high-level biocontainment capabilities to monitor and treat highly infectious pathogens. Testing and laboratory procedures are currently the primary tools for confirming the presence of the virus. According to the WHO and the European Center for Disease Prevention and Control, initial diagnosis is often conducted via polymerase chain reaction, or PCR, testing. However, health officials note that early diagnosis can be difficult, as the virus may not be detectable in body secretions during the first 72 hours of symptom onset. This creates a window of uncertainty where repeated testing is necessary. The Andes virus presents a unique challenge for hospital staff. Unlike North American strains, the potential for person-to-person transmission requires airborne infection isolation rooms and the use of N95 respirators, gowns, and gloves. Data provided by the WHO indicates that the incubation period for this strain can range from 4 to 42 days, which complicates the timeline for clearing suspected cases. While domestic travel fears persist, it is important to contrast the verified case count, 8 total individuals linked to a single maritime vessel, with the broader claims of a nationwide epidemic. The contrast between the sensationalist claims of a tourism collapse and the targeted, localized response of public health agencies highlights the difficulty of managing communication during an evolving international incident. Surveillance teams are currently meeting the ship at various ports, such as in the Canary Islands, to conduct exposure assessments and distribute questionnaires. These official statements emphasize that while the virus is lethal, the current outbreak is contained to a specific cohort of travelers whose movements are being strictly monitored by international health authorities. Prevention and public guidance remain the most effective tools for mitigating the impact of hantavirus, regardless of the strain. For the general public in the United States, the primary risk remains the indigenous strains spread by rodent populations in rural or semi-rural environments. Public health guidance for the prevention of hantavirus pulmonary syndrome focuses on minimizing contact with rodents and their excreta. This includes sealing entry points in homes and sheds to prevent rodent nesting and using professional-grade traps. When cleaning areas where rodents have been present, experts stress the importance of avoiding the creation of dust. Vacuuming or sweeping can aerosolize the virus, allowing it to be inhaled. Instead, the standard recommendation is to soak the area with a disinfectant solution, such as a 10% bleach mixture, for at least 5 minutes before wiping it up with a paper towel. For those following the international Andes virus situation, the limits of current medical knowledge must be acknowledged. There is currently no specific vaccine or antiviral cure for hantavirus infection. Treatment consists primarily of early supportive care, often requiring mechanical ventilation in an intensive care unit. The uncertainty regarding exactly how the Andes virus achieves person-to-person transmission, whether through close contact, shared fluids, or prolonged proximity in enclosed spaces, remains a subject of intense laboratory study. Scientists are currently using metagenomics and sequencing to determine if the strain on the MV Hantavirus has undergone any genetic changes that might affect its transmissibility. As surveillance continues, the public is advised to rely on verified updates from the CDC and the WHO rather than unverified reports of broad travel cancellations. Domestic travel within the United States remains unaffected by any official health mandates, and the focus of the medical community remains on the successful monitoring of the individuals currently in quarantine. The situation is evolving, and as more laboratory data becomes available, public health guidance will be updated to reflect the most current understanding of the risk landscape. For now, the emphasis remains on vigilance for returning international travelers and standard rodent proofing for those in endemic areas of the American West. Thank you for staying informed on this developing public health story. Please consider subscribing for further updates as new data arrives. The operational focus of the United States government has transitioned from initial detection to the logistical complexities of medical repatriation and high-level biocontainment. As of mid-May 2026, the Department of State, in coordination with the Centers for Disease Control and Prevention, has finalized the transfer of American citizens who were aboard the MV Hantavirus. These individuals are being managed under the most stringent public health protocols currently available. The repatriation process utilized specialized aeromedical biological containment system units, which allow for the safe transport of patients with highly infectious diseases via long-haul aircraft. Upon arrival on American soil, these passengers were immediately transferred to the National Quarantine Center at the University of Nebraska Medical Center in Omaha. This facility is unique in its design, featuring a 20-bed unit equipped with dedicated laboratory space and advanced monitoring technology that allows clinicians to observe patients without entering the immediate biocontainment zone. The use of such a high-security environment underscores the gravity with which federal agencies view the Andes virus, primarily due to its documented capability for person-to-person transmission, a trait not shared by the more common domestic hantavirus strains found in the Four Corners region of the United States. At the laboratory level, the diagnostic effort is centered on identifying the specific viral signature of the Andes strain. Public health labs are currently utilizing real-time reverse transcription polymerase chain reaction, or RT-PCR, to detect viral RNA in blood and tissue samples. However, virologists warn of a significant diagnostic hurdle known as the window period. During the initial prodromal phase of the illness, when symptoms resemble a common flu with fever, myalgia, and headache, the viral load may not yet be high enough for detection. This necessitates a secondary tier of testing focused on serology, specifically the detection of hantavirus-specific IgM and IgG antibodies, using enzyme-linked immunosorbent assays. Because the Andes virus can lead to hantavirus cardiopulmonary syndrome, or HCPS, which involves a rapid and often fatal leakage of plasma into the lungs, the speed of these laboratory results is a critical factor in patient survival rates. Medical teams in Omaha and at international clinics in the Canary Islands are monitoring for specific indicators of disease progression, such as a falling platelet count and the appearance of immunoblasts in the peripheral blood, which often precede the onset of severe respiratory distress. While domestic headlines claim a total collapse of the American tourism industry, an analysis of official statements from the Federal Aviation Administration and the Transportation Security Administration reveals a more nuanced reality. Despite the public anxiety surrounding the Andes virus cluster, no federal mandates have been issued to restrict domestic air travel or close state borders. The CDC's current travel notices remain at a level 2, or exercise increased caution, specifically for those traveling to the South Atlantic or regions where the long-tailed pygmy rice rat, the primary reservoir for the Andes virus, is endemic. This contrast between sensationalist reports and agency data is a focal point for public health communicators. Officials point out that the 8 reported cases are strictly confined to a single cohort associated with the MV Hondius itinerary, which included South Georgia Island and the remote British Overseas Territory of St. Helena. There is currently no evidence of community spread within the continental United States. The challenge for agencies like the WHO and the CDC is to manage the international contact tracing effort for the 147 passengers and crew who have since dispersed to 23 different countries. Ensuring that every individual is accounted for within the maximum 42-day incubation period. In terms of shipping and trade, maritime authorities have not halted the movement of cargo, but they have increased the frequency of vessel inspections for rodent activity, particularly for ships arriving from South American ports. The international response is currently governed by the International Health Regulations of 2005, which provide a legal framework for countries to manage public health events while minimizing interference with international traffic and trade. Hospitals across the United States have been instructed to review their identify, isolate, and inform protocols. Unlike domestic hantaviruses, which only require standard precautions because they are not known to spread between humans, any suspected case of the Andes strain requires immediate airborne infection isolation. This involves the use of negative pressure rooms and rigorous personal protective equipment for all healthcare workers, including N95 respirators and full face shields. The containment of the current cluster depends entirely on the efficacy of these hospital protocols and the continued accuracy of the laboratory surveillance network, as the window of potential incubation for the MV Hondius passengers begins to close. As the international community monitors the specific cluster of Andes virus cases associated with the South Atlantic, public health guidance for the general population emphasizes a return to foundational prevention strategies. While the headlines regarding a total cessation of domestic travel are not supported by current government mandates, the situation serves as a critical reminder of the ongoing threat posed by zoonotic pathogens. For the average resident in the United States, the primary risk of hantavirus remains the indigenous strains, such as the Sin nombre virus, which do not typically exhibit the person-to-person transmission seen in the Andes variety. Prevention in the domestic context is almost entirely centered on rodent control and environmental management. Officials recommend a rigorous seal-up, trap-up, and clean-up approach. This involves identifying any opening larger than 1/4 of an inch in residential or storage structures and sealing them with steel wool or metal flashing, as rodents can easily bypass softer materials. Maintaining a perimeter free of woodpiles, trash, and heavy vegetation is also cited as a primary deterrent to the deer mouse and other known reservoirs. Practical takeaways for cleaning potentially infested areas are vital for preventing the aerosolization of viral particles. Public health agencies strictly advise against sweeping or vacuuming areas where rodent droppings or nesting materials are present, as these actions launch the virus into the air where it can be inhaled. Instead, the established protocol requires the use of a disinfectant solution, typically comprised of 1 part bleach to 9 parts water. Users are instructed to thoroughly spray the affected area until it is completely wet and allow it to soak for at least 5 minutes before cleaning with paper towels or a mop. This chemical inactivation of the virus's lipid envelope is a fundamental step in breaking the chain of transmission from animal to human. For those working in enclosed spaces with high rodent activity, such as barns or crawl spaces, the use of a NIOSH-approved N95 respirator is recommended as an additional layer of professional-grade protection. The limits of current medical science regarding hantavirus are a significant factor in the cautious tone adopted by Surveillance Agency (S). There are currently no FDA-approved vaccines or specific antiviral medications for hantavirus pulmonary syndrome. Clinical management remains focused on supportive care, which may include the use of extracorporeal membrane oxygenation, or ECMO, to oxygenate the blood when the lungs are failing. The clinical uncertainty regarding why certain individuals develop severe disease while others remain asymptomatic is an area of active investigation. Furthermore, the exact biological mechanism that allows the Andes virus to transmit between humans, a rarity among hantaviruses, remains under intense study. Researchers are examining whether the virus is shed in higher concentrations in the upper respiratory tract compared to other strains, which would have significant implications for future quarantine and PPE protocols in hospital settings. Looking forward, the ethical responsibility of public health reporting requires a balance between necessary vigilance and the avoidance of unfounded panic. The current epidemiological data indicates that while the Andes virus is a severe pathogen, it remains geographically isolated to specific exposure events. The narrative of an end to tourism is currently a reflection of public anxiety rather than a verified medical necessity. Authorities continue to stress that informed travel and adherence to sanitation guidelines are the most effective ways to manage the risk. As the 42-day surveillance window for the MV Hondius contacts continues, the focus remains on the rapid identification of symptoms and the transparent sharing of data between nations. Vigilance, rather than isolation, is the prevailing recommendation from the global health community. By understanding the specific transmission pathways of these viruses, the public can navigate domestic and international travel with a realistic assessment of the risks involved. For continued updates on global health, surveillance, and emerging pathogen data, please consider subscribing to this report.